Good evening. We apologize for the late start. This evening, we are going to be continuing our conversation on COVID-19 and the effectiveness of the vaccine. That has raised so many questions that we aren't yet going to start with the rollout in Barbados because we believe that there are still questions which need to be answered. And in studio this evening are Dr. Omar Edwards, Medical Officer of Health at the Winston Scott Polyclinic. He is a medical doctor. He has a Master's of Science degree in Public Health, and he also has a Master's of Science degree in Infectious Diseases from the University of London. Senior Health Sister Juliet Serrano is a registered nurse and midwife. She has 13 years experience at the QEH. She is specialized mainly in the area of pediatrics and pediatric intensive care. She has a diploma in public health nursing and public health administration. She has worked for 22 years in primary health care. She has a master's degree in public health. She is chairperson of the Immunization Committee and presently a member of the COVID-19 Vaccine Planners Committee. And joining us from the United States, Washington, D.C., by Zoom, is Reverend Dr. Kirtley Yearwood. Dr. Kirtley Yearwood is a Barbadian. Some of you may remember him from the law school and from the days when he preached here in Barbados. He is a medical doctor. He is a pathologist. He has training and a master's degree in public health. He is an administrator in the public health system in the United States. He is taught at George Washington University, School of Medicine, and the Emory University in Atlanta, Georgia. He is very well qualified. He is a priest, and then he has his medical background. But this evening, not only is he going to be talking about the vaccine generally, but Dr. Yearwood is going to share his experience with other Barbadians since he himself has had both doses of a COVID-19 vaccine. So we're going to find out more from somebody who has had the jabs. We start this evening with Dr. Edwards. Welcome to all our guests. Welcome to all discussants. We have a number of questions that have still been coming in from the public. I'm proposing to put some of these to Dr. Edwards and to Senior Health Sister Serrano. Dr. Edwards, so some general comments from you before we start going to the questions, please.
Thank you, Ambassador Thompson, and good evening, Barbados. Barbados will shortly begin the rollout of the COVID-19 vaccination. This is a special moment for us. It is an additional weapon in our fight against COVID-19, the global pandemic that is affecting everyone, and we are no exception. We intend to deliver an educational program on the science of the vaccine. We intend to answer your concerns with the vaccine. There's a lot of literature, there's a lot of media coverage, there are a lot of questions. Remember that vaccines, they are safe, they have been created to prevent infectious diseases. Next to clean water and sanitation, vaccines are among one of the foremost public health measures that save lives. So at the end of the day, we're looking at a life-saving intervention here with the deployment of the COVID-19 vaccine in Barbados. We will go into more specifics of the vaccine and try to answer any concerns that you may have.
Dr. Edwards, you are involved in the training that is being done for medical professionals here in Barbados. Can you tell us, please, who you are training and how many people have been trained in this preparatory process so far?
Yes, so training has begun for medical practitioners, for nursing practitioners, for other members of the teams that will be involved in the vaccination campaign. This is not a public sector only approach. This would include the private sector. This would include volunteer groups. So the training that we have devised will give you a background on the disease COVID-19, a background on the particular variants of concern globally and here in Barbados, a background on the vaccines available, specifics on the vaccine we are looking to introduce here. We are also very cautious that, and the training will include the medical management of the entire process. So this is going to be a thorough training. We're going to cover the vaccine. We're going to cover any adverse effects that may happen. We're going to cover the observation period post-vaccination. We're going to look at the public health situation. We're going to look at the aspects of the logistics, and complete coverage, every step of the process will be covered in the training.
Thank you so much. We have some questions coming from the public. There is one here from an individual who says, I have severe allergies, so much so that I have to use an EpiPen. Would you advise that I take this vaccine or not?
All right, that's a very good question. Now, severe allergies, this can be a concern. So the first thing that will happen is a medical evaluation of this person will be undertaken. Okay? We first want to know if the severe allergy is to any component of the particular vaccine that we intend to use. Once we are certain that that is not the case, we can proceed with this individual, but we will do it in a clinical setting. This person will receive the vaccine, should they agree to have it, in a clinic, fully prepared, and we will monitor them throughout the entire process. Of course, we will always inform, and we'll give them opportunity to decide. But yes, the good thing about the vaccine that we're going to introduce here, we have had no incidences of these very severe allergic reactions, so that's a very good thing, and we will approach each situation of that nature on an individual basis.
Thank you. Another question, this time from the community of Jehovah's Witnesses, is does the Oxford AstraZeneca vaccine have in blood or blood products?
A very good question. The Oxford AstraZeneca vaccine does not contain blood products. The vaccine of itself looks at genetic material, which will form the basis of the immune response, but there are no blood products within the vaccine.
Can you tell us a little more then, if there are not blood products, what is in the vaccine? Because we've heard so much about what is and is not in it.
Yes, so the vaccine will be a novel vaccine. It has a new mechanism. So the vaccine will actually deliver some genetic material. The genetic material, once delivered inside the body, will stimulate the cells to produce the coronavirus spike protein. Now, not the coronavirus. So the basis of the immune response will be to the spike protein, and this was alluded to by previous speakers yesterday. So the vaccine will create just that one part of the virus which the body will use to make and mount the immune response. So there's no blood product involved in that. There's a little bit of genetic material delivered. The spike protein is produced and an immune response will result from that.
Is there any difference between the way vaccines work generally by promoting an immune response and this particular vaccine works? Is there a major difference? Or is the mechanism still sort of generally the same?
Right. So the end result is generally the same. So most vaccines that we have indeed will end result would be an antibody response to the particular pathogen. What is new here is how that process begins. So for these COVID-19 vaccines, the process begins with the delivery of genetic material For the Oxford AstraZeneca, we're looking at DNA. For Pfizer, you would have the messenger RNA material. But once that is introduced into the cell, is incorporated into the protein-making machinery that will eventually lead to this complete immune response. So the end result is similar. So you will have antibody production. We've had this in the past with other vaccines. We've had the pneumococcal vaccine. We've had these other vaccines available in Barbados. So that end part of the process is indeed similar.
There are several vaccines on the market, so we're hearing, are the vaccines safe? Are they reliable and effective?
Very good questions. So the vaccines available on the market, we have the big four for COVID-19 at this time. So you have your Pfizer vaccine, you have your Moderna vaccine. On the Russian side, you have the Sputnik Gamaleya vaccine, and you have the Oxford AstraZeneca. Now, all these vaccines are relatively safe. In particular, with the Oxford AstraZeneca, there's been a low incidence reported of severe allergic reactions, so that is a good thing. The effectiveness or the efficacy of these vaccines will vary, but all of these vaccines produce an efficacy above 60%. So what that translates to, persons receiving the complete course of vaccination will be offered a measure of protection against severe disease should they contract COVID and the subsequent complications of that. That also translates into the medical sense in the form of reduced hospitalizations. So this is what you want, an effective vaccine. You have decreased symptoms, you have decreased severe medical course, and the patient is more likely to survive. So this is what we want at the end of the day for the vaccine to save lives.
I have a question here from a lady who says, I'm going into hospital for an operation. Should I be vaccinated before I go, or should I wait until after the operation?
Well, the operation is a particular case, and it is a case of timing and specifics. So once the vaccination process is begun, after the first dose is administered, we would say give it 3 weeks to become effective. You are not fully covered, so to speak, until after the second dose is given. So for that particular case, the person should liaise with their medical provider and go into a little bit more detail depending on what they need to have done.
You spoke just now about a second dose. Some of these vaccines are single dose, others are a double dose. How effective or how protected are you after you've had dose 1? And must you absolutely have dose 2?
Okay, so we are in a sphere of constant changing and evolving science as the research comes in. So what we are saying at this point, you begin to see protection after the first dose of the vaccine is administered. That protection will start to become practical to the particular individual at least 3 weeks' time, and then it will increase. Then, for all these vaccines thus far, there is a second dose to be administered. So in the case of the Oxford AstraZeneca vaccine, that second dose will be given between a variable period of 4 to 12 weeks, and your strongest response will be after the second dose has been administered, about 15 days after. But you still have a measure of protection 3 weeks after you receive the first dose.
I have one more question for you. So far, the majority of deaths in Barbados have been amongst people of very advanced age. We learned yesterday that the greatest vaccine hesitancy is between persons aged 35 to 49. Does this vaccine hesitancy in that age cohort surprise you? Are younger people in that age cohort at risk of COVID at all? or of the more severe forms of COVID, because there is a perception that they're not?
Okay, an excellent question. Now, the older the individual, should they contract COVID, the more severe the course is likely to be. So the highest group currently at risk would be the elderly. You also have groups with comorbidities, with diabetes and these other things. They're also at risk. So yes, the elderly are predominantly at risk. Younger persons with comorbidities, whether it's diabetes, whether it is asthma and other conditions, they're also at risk of severe disease. So youth of itself should not really be the end all to it in that aspect. So the entire population should approach the COVID-19 disease with caution, because the clinical course can be unpredictable even in younger persons. Even if death does not occur, severe disease can still happen in younger age groups. Yes, the elderly will fare worse, but the younger age groups should also be cautious. And also there is a public health aspect to this as well. The younger persons, you have a family unit, and you need to help protect them as well. So taking the vaccine can also help protect your extended family as well.
Before Dr. Edwards, before I move from Dr. Edwards to Senior Health Sister Serrano, you will recall that yesterday, the president of BAM, Dr. Linda Williams, was with us, and I asked her to demonstrate the proper wearing of a mask. Since Dr. Edwards is with us today, and there is still uncertainty about some of these matters, what is the correct way? A lot of people are washing their hands, but perhaps not necessarily as thoroughly as one would wish. People are wearing masks, but we know not correctly. Dr. Edwards, would you be kind enough, please, to demonstrate? We have sanitizer available for you. Would you be kind enough, please, to demonstrate what is the correct way to wash hands and to sanitize, so that we are properly protected? And can you explain as you go through, so that you are showing us what it is we're supposed to do?
Okay, so before we begin, there are a few pointers to observe. If your hands are visibly soiled, they should be washed with soap and water. After that point, and this is not the case, an alcohol-based hand rub or hand sanitizer is a very effective method of promoting hand hygiene, which decreases the transmission of pathogens, including COVID-19. Now, the choice of the hand rub is important. You need at least 60% alcohol in the hand rub. So the CDC guidelines, for example, 60 to 95% in your product, and then you can begin. So selection of the product is first. Now, you have to, similar to washing your hands, you have to put a generous amount of the hand sanitizer in the palm of your hand, okay? And you begin to rub. You cover the external aspects first, but remember, the spaces in between your fingers, they have to be covered as well. There are places where the germs can hide. Make sure you cover the insides of all the fingers. It is very good also to rub the palms, the back of the hands, and thoroughly. The process is not complete. You will rub and you will rub. The process is not complete until it has dried naturally. Remember that. So you complete the process and you rub and you allow your hands to dry naturally. As the hand rub evaporates, that has a protective effect against the pathogens. So especially alcohol as well, as it evaporates, it destroys bacteria, it destroys viruses, it destroys germs. So allow the process to be completed. You use the hand sanitizer, you've rubbed it, then allow it to air dry, and there you would have your process. Repeat as often as is necessary, given the context of the environment that we are in. Proper hand hygiene is very vital in this fight against COVID-19. The mask is very important, but the hands are also a significant source of spread of the disease. Wearing your mask appropriate hand hygiene, an excellent combination to reduce the spread of COVID-19.
Before you sit, tell me about the ladies with long nails like me.
Yes, so ideally, you still have to get under the nails. The nails can harbor some germs. In some instances, it would be preferable to use the actual alcohol. That is acceptable too. Again, the same percentage, 60 to 95%. Get it in all the areas and allow it to dry. So if the rubbing is a bit of a challenge, you can actually spray the alcohol onto the nail bed, cover the entire area, and allow it to air dry. Once the surface is covered, you have an effective hand hygiene solution here.
Thank you so much. Senior Health Sister Serrano. We had our first nurse yesterday, and today we have our second. Welcome. Thank you so much for being with us. We have discussed your experience at the beginning, and you are considerably experienced and very well trained. My first question to you is, can you tell us a little bit about your involvement with vaccines and vaccination, the vaccination process in Barbados, and then specifically what role are you playing relative to the preparation for the COVID-19 vaccine?
Good evening, Barbados. Good evening to the press. First, let me say I have a very long history dealing with vaccines and immunizations. I would say my attachment first commenced in 2003. That was immediately after completing my public health training. At that time, I was assigned to St. Philip Polyclinic, and almost immediately, my senior at that time assigned me to the immunization room. And that is where we start to immunize babies. At that time, it was from 3 months. And we follow our national immunization schedule. Not only children were offered vaccines, but we offer vaccines throughout the life cycle. You know, persons are usually encouraged and reminded to have their tetanus toxoid status updated. And that is, you need boosters every 10 years. Also, persons who were entering colleges and universities and traveling, etc., they're required vaccines as well. And it was around that time, there was an initiative from PAHO WHO, which was known as Vaccination Week in the Americas, where the initiative was more or less to educate the population from within the region on the benefits of vaccinations, and also to make sure that vaccines were equitable, that all countries had equal access to vaccines and immunizations, and also to keep vaccines, more or less on the political agenda. So it was around that time I was asked to be a member of the Dane Immunization Committee. Presently, I'm the president of that committee. I also remember it was in 2007, we were preparing for World Cup World Cup. And it was anticipated that there would have been thousands of persons entering our shores. And as we all know, these diseases are just a plane right away. So it was then that the Dane government, took the initiative to ensure that our population was more or less immunized. And the vaccine being offered at that time was the seasonal influenza vaccine. And that was the first time that it was introduced here in Barbados. And the initiative was, at that time, to start with the frontline workers, similar to what is being done here. I remember it was myself and a team. At that time, we had time to prepare. It is not like now where we need all the extra resources. But at that time, the resources were quite adequate. I remember going from as far as St. Philip to St. Lucie, and we immunized thousands of persons. We immunized the frontline workers, we went to the airports, the seaport, the defense force, the hotels, the nursing homes, the healthcare workers, hospitals, the geriatric. We immunized thousands of persons. And I can safely report that, we didn't have any major adverse effects. It was only what is usually expected when you receive a vaccine. You might get a little pain at the injection site, you might get a little tenderness, but everything went well. And I feel happy to report that our World Cup cricket, it was a success, and there wasn't any, any increased incidences within the flu at that time. Because, at that time as well, there was the SARS and there was the H1N1, and the campaign was very successful. I also remember other campaigns like the MMR campaign, and that was done, the last campaign we had was in 1999.
What's MMR?
Sorry, measles, mumps, and rubella. That campaign was launched across the island-wide, and that campaign was uneventful as well. Where vaccines are concerned, as a question that was posted a little bit earlier about a bit of hesitancy, vaccines, these diseases are prevented by just a stick. I remember growing up as a child, these childhood diseases were very prevalent within the society. I remember there were at least three young ladies within my community who had deformities as a result of polio. Also, I am aware of persons who develop measles as adults and they end up, being deaf. I also know of 2 individuals who developed, it was chicken pox as an adult, and those persons are bedridden today. So the benefits of vaccines. I also remember a couple of years ago, I met this gentleman and he had some severe deformities, and out of curiosity, I more or less asked him, what was his, problem, etc. And he reported to me that he had polio as a child. He said that today he hasn't forgiven his mother. She refused to have him immunized. And he said, as a father today, I make sure that my children are immunized. Also, my experience goes way back to Queen Elizabeth Hospital. I remember working there, it was in the 90s, and there was a high incidence back then of meningitis. There was the Haemophilus influenza meningitis, and there was also the pneumococcus meningitis. I remember the pain and the discomfort that those little babies and small children had to undergo, having a lumbar puncture taken. But I'm pleased to say that we introduced the Haemophilus influenza vaccine, that was in 2001, and the pneumococcus vaccine in 2008. And as a result of that, these diseases are not as prevalent. There have been a significant reduction in these diseases.
So you are involved now, you spoke about the vaccine committee, you are involved in that. Can you tell us specifically about how you are helping to prepare our nursing fraternity and if anyone else for a vaccine program in Barbados, a COVID-19 vaccine program in Barbados?
Right now we are more in the stage of preparation, and we all know that there's a global shortage of nurses. And we have thousands of persons to vaccinate. So this is more or less a national effort. We have our public health nurses on board. We have our staff nurses, midwives from within the primary healthcare setting. And we have also reached out to other additional persons. We have the retired public health nurses. They are willing and they have agreed to come and assist us. We also have nurses who have indicated their desire to assist as well, and this was done through the Barbados Nurses Association. There's also doctors from BAM. I heard yesterday that there were at least 45 doctors who volunteered to assist with the rollout of the vaccines. Only sitting here this afternoon, I got a WhatsApp message from 2 doctors from within the private sector, and they are willing to assist. They just want us to tell them exactly what needs to be done. I mean, it is a national effort, and we see the situation that is occurring within our country as a result of COVID. We know the benefits of vaccines. You know, centuries ago, I think it was in the 3rd century when we had it was smallpox. Smallpox, claimed millions of lives. And it was only through our effective public health measures where vaccines and immunizations are concerned that the WHO declared that smallpox have been eradicated from within the region. Vaccines, as Dr. Edwards said a short while ago, it is one of the most effective public health interventions. And with the introduction of this vaccine, the AstraZeneca vaccine, it has been proven by, the data suggests that with the introduction of this vaccine, along with the other vaccines, there have been a reduction in the incidences of COVID-19. Presently, what we are doing at our local levels, right now we are targeting, first of all, our frontline workers and our healthcare workers. Because you can't appreciate the fact that we are out there and we need to be protected so that we can provide, high quality of care to you. So right now at each polyclinic, there are 9 polyclinics in Barbados, and we are all responsible for various areas. At Bradford Tate Polyclinic, we have 19 different areas. We covered places in St. Michael's and St. James. So what we are presently doing, we started with the the training aspect. Only like last week, we received lots of supplies to commence the campaign. We got like needles and syringes and ice packs and containers and etc. So that we would need the PPE, exactly what we need to embark on this campaign. Also, as I said before, the human resources, so we are no more or less looking at the logistics. We have identified...
Because we want to have a program on logistics where we really can go into the detail for the members of the public. The key thing is that as a public health nurse with tremendous experience, you and other health officials are saying to Barbadians that the COVID-19 vaccine is safe and you are recommending it as a health professional.
Yes, we are.
Okay.
So,
and how many people would you say that you have vaccinated over the years?
Thousands of persons. And I can safely say I've never had any, severe reaction, but we are prepared for whatever come our way. After the vaccine is given, we are not going to let you just leave and walk away. We will let you stay with us at least for 15 minutes or so, where you will be monitored, and you will be monitored by trained medical persons, whether they're nurses or they're doctors. We have everything that we need in case there's any, unforeseen incidences. And as you know, with adults are poor receptors of vaccines than children, because, we get also anxious and start to hyperventilate, etc. But we will be there to cater to, all eventualities.
Well, let's hope there are no serious eventualities for which you have to cater. Thank you so much, Senior Health Sister Serrano. Joining us by Zoom from Washington, D.C. is Reverend Dr. Kirtley Yearwood. As I indicated, Dr. Yearwood is a Bajan. He is by training a priest. He is by training a medical doctor. He is by training a pathologist. He is by training a hospital administrator. Dr. Yearwood, thank you so much for being part of the program this evening. I'm going to start with what I think people will find the most interesting thing. and then work backward, which is that you have had a COVID-19 vaccine, and I believe you have had both doses. Am I right?
That's correct. Good afternoon, good evening, Ambassador Thompson. Thank you for the invitation to participate in this conversation about the COVID-19 vaccine. Good evening as well, fellow panelists, and good evening, Barbados. Indeed, I have had both jabs of the vaccine. I got my first vaccine, the first jab on December 23rd, and the second one on January 11th. Absolutely no side effects. After my first dosage, my left arm felt a little bit heavy for about a half hour or so, and that's it. No fevers or anything else like that. So I can testify to the importance of receiving a vaccine and the mild symptoms that some people do experience. I was fortunate not to have any. Here in Maryland, where I am, just outside the Washington, D.C. line, I serve as Chief Mission Officer of Holy Cross Health. And Holy Cross Health is a not-for-profit Catholic health system that serves more than 240,000 patients each year from Maryland's two largest counties of Maryland and of
So
Montgomery
the entire
County.
population of Barbados.
Okay, about a third of the population of Maryland lives in these two counties, so that's our drawing pool. We have two large hospitals, about 10 primary specialized care clinics, home care, hospice. So we are a large system. We see about 160,000 or so inpatients, about 134 outpatients, large staff, 4,000 staff, about 2,400 physicians, and 250 volunteers enable us to serve and administer the care. As part of my role, I have multiple things I'm involved in, but recently I've been involved a lot with the coordination of the vaccinations to our colleagues as well as the larger community. We started vaccinating people here on December 18th, and as of Friday, we have administered 11,300 vaccinations to our colleagues, our staff, and the community members who are still coming in, those 75 years of age or older. We've had no one to die from receiving a vaccination. Mild symptomatology, some individuals complain of a little mild fever or a few body aches, especially after the second dose, which you would expect as the immune system is revved up. But no one has died in the meantime. We have so many people who have died from COVID and continually. Here in Maryland, our positivity rate is dropped somewhat to 5.89% of the population in Maryland are positive now. And, we were one of the first to start diagnosing COVID patients in the state here. So far, we've treated almost 6,000 patients with COVID and so many deaths. The number of deaths have started to come
I'm
down.
going to ask you to pause there. You've seen 6,000 patients, your hospital alone, and you said roughly a year, 240,000 patients, and in that group, you have seen 6,000 cases. And how many deaths have you seen at your hospital?
The most recent stats, so when we first started, our mortality rate, 23%. That was in March and April when the pandemic first started. As of today, our mortality rate is approximately 5%. We have learned how to treat COVID as a profession all over the world, as we have learned more about the disease and ways of treating patients who die, who have the disease. We do have several deaths. As of today, for example, we have 87 patients in our hospital with COVID, one death over the weekend. So the number of deaths have started to come down as we have ramped up the vaccinations across our state and across the region. So the vaccine is already beginning to have an impact. Of course, people are still encouraged and are mandated to wear a mask and social distance and wash your hands, because unless we have a good 75 to 85% of the community vaccinated, in other words, herd immunity, we are going to be in a posture of having to wear masks and social distance and keep our hands clean in order to prevent the spread of infection of this COVID, especially with more variants coming on. Now we have the UK variant, we're expecting that. The South African variant, as you know, is in South Africa, and they've just yesterday stopped using the vaccine just because that's the vaccine that's not very effective against that particular variant, as was mentioned yesterday in this broadcast. I watched it as it was occurring. But we are seeing, more of a transmission, but people are not as sick once they have this vaccine in the community. So we are making good progress. So I would urge all Barbadians, everyone, to really take the vaccination.
Thank you so much. Let me ask you another question. You are a priest, a doctor, you're a hospital administrator. You are seeing this beast COVID close up. You have an understanding of what is happening across healthcare systems in Washington, D.C., in the United States, and globally. And you're looking on at your home country, your birth country, the country where your navel string is buried, to use an old Bajan expression. What is your view of how we are performing and how we are doing? Because, our cases have risen, but it seems to me when I look across the globe, we still have some of the lowest statistics globally. And our data, when you do comparative analyses, we are still really doing exceptionally well. Can you tell us a little bit, as a health professional, what is your opinion, looking on as a Bajan from outside and wanting the best, of course, for your country?
Sure, Barbados is doing quite well. You did a very low positivity rate, a very low death rate. You're doing extremely well. It's always easier for a smaller nation to lock itself down and isolate, and therefore I've been very impressed with the measures taken by the government and others to curtail the spread of this disease. We have to say, however, that we are human beings. Staying in lockdown and lack of socialization is hard on people. It's natural to want to get out and mix and mingle with your friends and family. So it's challenging, but it's so very, very important for people to maintain those measures as a way to curtail the spread. If we relax ourselves and start hanging out and partying and going to the various ram shops, etc., we have the tendency therefore to spread this disease even more. You cannot see the enemy. That's why it's so hard. When you put on a mask, you're protecting yourself as well as your neighbors, mainly your neighbor. We could have this disease and not know we are transmitting it. Once you've had the vaccination, you still may have the disease. You're just not likely to get as sick to be hospitalized. You can still spread. Hence, it's important, even when you do receive the vaccination, to maintain the social distancing, wear the mask, wash your hands. We're going to be in this posture of mask, washing hands, and social distancing for months and months, probably over a year to a year and a half in some countries, depend upon how quickly countries are able to achieve herd immunity. So the longer people wait and make decisions about I may or may not take it, we're only prolonging the likelihood of the COVID virus hanging around even longer. The only way to curtail the spread is really to maintain those measures, in addition to receiving the vaccine to decrease the amount of pressure on a healthcare system. Barbados has done extremely well. I'm very proud to be a Barbadian in the way how the government and others in the medical industry have really dealt with this challenging global pandemic. Our borders are open, tourists are coming in, people are constantly in and out. People could be bringing the virus, and we could be taking it out. We can't see it. So we have to take these measures. They might seem challenging because they are, but it's so very important in order to maintain and to maintain the sense of security and really decrease the spread of this virus.
Thank you so much, Dr. Yearwood. I have one last question for Dr. Edwards before we open the floor to the media, and we do have a full media house this evening. Dr. Edwards, will we be checking the antibody production in persons who have been vaccinated? And then it becomes very technical. So perhaps we'll let you answer the first part first.
Okay, a very good question. So the first part certainly of our campaign is to get the vaccine out there. Now the backup science is very good. You want to see a robust antibody response. So it'll be good to see what happens in our population as they get the vaccine. So I think yes, we should do some sampling for antibodies once we've administered the course and see what's happening scientifically in Barbados. We want to know the vaccine has come from overseas, but we want to see how our population reacts to it. So yes.
So I'm going to ask you
yes.
then the second part of the question and ask you to explain to those of us who are not doctors what this means.
Good. So
If yes, will it be the IgM or IgG antibodies that we will be testing, and at what time frame after inoculation?
okay, very good questions. So
But tell us first what it means, because
Yes,
I don't know
so-
IgG and IgM.
So when we speak of IgG, we speak of IgM. So IgM would be the first antibody really that you would have early in an infection, okay? So that's the first antibody response that the body will make. Now, once the body learns, after it has encountered a virus, a germ, a pathogen, whatever, it makes IgG antibodies. Now, the IgG antibodies give you a more rapid and a specific response to that particular pathogen. So the body will remember what it has encountered. So if you meet something for the first time, the IgM part of the system is going to kick in until the rest of your immune system can actually mount a greater response. So it's like mobilizing an army, so to speak, within the human body. So IgM is the guard at the door. That's going to work first. As the body gets to learn the pathogen, the IgG is going to come in. The IgG is going to be specific to that particular pathogen, and the IgG response is tailored to be fast, effective, and quick response. So the thing to note here then, in testing for the antibody levels, you first have to administer the complete course according to the science of the vaccination. So you're going to give both doses before we even look at that. So for the vaccine that we're going to be using, we're going to say give the first dose. After we've administered the second dose and 15 days have passed from there, then the antibody testing can come into play at that point. Okay, so that's when we expect a significant antibody response to be mounted. So as we sample the population, for example, if for whatever reason we find that that is not the case, we have to look back at the science, we have to look back at what's going on. Every population has certain genetic markers and certain genetic variabilities. It's not only for the vaccine, it's for any drug, whether the drug is for hypertension or whatnot. You have to look at your specific population. These are very good products, but you have to find what's best for your population. So this is where the antibody testing comes in, and it is very useful. This would not be a new process. We have done this when we have looked at things like hepatitis B. Okay, so when we want to verify healthcare workers have mounted antibody response to other vaccines, we have done this. So this will not be a new process by any means. It is just a verification of an antibody response to a particular vaccine. And of course, in clinical trials, this is a necessary part of the evaluation. A key part of developing a vaccine is to see that it makes that response. If it does not make that response, something has to change. So yes, at the appropriate time, I'm sure that will be done.
But we have experience in Barbados in this level of scientific rigor.
So yes, there is no shortage of experience and talent in Barbados. Infrastructure and systems, yes, can be built up, but we have a wealth of experts. We have persons here that have the knowledge, have the know-how They're accustomed to dealing with these things and interpreting them. Now, when you speak of a population, it's just a matter of scale. Okay, so at a university, you can get these things done. You can get these things done now if you have to. But if you're looking at population, you would just have to scale up the effort. But it's not a question of expertise. You acquire the appropriate resources, and we are good to go.
Thank you so much. I can tell you that the person who asked the question said that your answer was an excellent one. So thank you. Thank you very much. We have a full media complement this evening, ladies and gentlemen. I therefore wish to welcome via Zoom Mr. Emmanuel Joseph of Barbados Today, Ms. Wendy Burke of Starcom News, Mr. Ryan Broom of CBC, and Mr. Colville Mounsey of Nation News. Ladies and gentlemen of the media, good evening to you. My guests, my discussants are available for your questions.
Good evening, Joseph, Barbados Today. It is our understanding that a man who had kidney issues passed away today. Any knowledge of this?
Mr. Joseph, thank you very much for your question. At the end of the information is just coming in, and I will make an appropriate announcement at the end of today's program.
My other question is that in our efforts to keep things sanitary and protect ourselves from the virus, the germs, and all that, how important is it in our campaign to stress the issue of money and the doorknobs and little things that we take for granted? How important is that to wrap it into the campaign in terms of our health?
Okay, so to tackle that question, you have to look at hand hygiene. So these are things that you touch. Whether you go to the supermarket, you go to the bank, you go to a place of business, you may touch a countertop, you may touch a doorknob. What should happen, ideally, thereafter, is the appropriate hand hygiene. So if you visited a place that is not your residence and that occurs, it is ideal to have the alcohol-based hand rub on you or the alcohol. But bear in mind, though, in Barbados, there are some strict protocols at the entry points to business places. So on entering business places, there is available either the alcohol-based hand rub or the alcohol solution. Both are effective, and hand hygiene should take place there. What that means is, once it is done appropriately and you've entered the facility, we can say that there is a decreased germ count on your actual hands. So you, as from that perspective, should not be spreading too many germs, if any, via your hands in that particular place of business. Okay? After you've done your business, you return to your vehicle or other means of transport. You should have on your person either the alcohol-based hand rub or some alcohol solution, and you repeat the process again because you would have touched things. Okay? And this would include money, but you would have touched things. So it's a process. Appropriate hand hygiene. You've worn the mask as well to enter the establishment. So these are two important factors in that particular individual who has entered this business in not spreading disease, okay? Anyone can have anything, but the thing is not to spread it. So you wear your mask, the hand hygiene is done at the appropriate entry point to the business, so that already takes your risk down. After you've completed whatever task you've done in there, you should repeat that for yourself, whether it's at your vehicle, do the appropriate hand hygiene. When you go home, the same thing. All right, so these are practical and effective measures. We know that hand hygiene works. It is not only for COVID-19. It would have worked for influenza. It would have worked for SARS. It works because as human beings, we like to touch everything. We manipulate our environment. So next to actually inhaling the pathogen, you use your hands. You rub your face multiple times a day, whether you know it or not. So this is how germs spread. So the appropriate hand hygiene, the appropriate attention to your environment when you enter a business, a workplace, and what to do. If for whatever reason you feel that there's a slip up in your general caution, you perform hand hygiene. Okay? whether it is soap and water, whether it's the alcohol-based hand rub. You may have touched something by accident, but that's what the hand sanitizer is for. Nobody will stop you from having it on your person, so you use it. These are safe, effective, and practical measures. They have worked for other diseases, and they do help in the fight against COVID-19. So there's an individual response. There have been laws put in place, and there have been protocols put in place at businesses as well for this reason.
Okay, just a brief follow-up. I know this might be something that might seem mundane, but do you think it is important to wrap this into your message because people tend to take these things for granted?
Yes, there has to be a constant repetition and a constant reminder of these things. Not only the hand hygiene, but after a time, people grow weary of certain measures, whether it's wearing the mask, whether it's the constant hand hygiene, you tend to slip up over time. But this pandemic is a dangerous one. We can't afford to slip up. We want to interrupt the transmission, whether it is in the workplace, even in your own household. The thing is to interrupt transmission, and that's what this does. We have to get accustomed. It has to become part of our habits going forward. Really, it should be part of it should be instinctive right now. You enter a certain place, you expect certain things to happen. If you don't see the hand sanitizer station, you may look at the management and say, but we expect certain things to happen here. I mean, even children do it. They come to certain places, they put out their hands because they expect to either be sprayed with alcohol or perform hand hygiene. So even the younger ones are learning it, and they're doing it, and they're expecting it. So we as human beings have the ability to rise to any challenge. This is a basic measure, and it is still integral in the fight against COVID-19, and it will be integral in the future for other pathogens, right? So good hygiene is always good.
Yes, hi, good night. Colville Munzi from Nation News. I have a few questions. The first one, maybe Ambassador Thompson can shed some light on this one. There was a survey done with regards to assessing vaccine hesitancy. I think you would have alluded to the age range in which there is some hesitancy. Could you give me any further information with regards to whether there can be some generalizations as to what percentage of the public is experiencing that hesitancy about the vaccine? And then I have a follow-up question for the virologist or who is here, or the doctor who is here.
I don't have the full survey results. I will get them so that on the next occasion when I'm here, I would be able to speak to them. And in fact, when all of the analysis has been done, then you would be able to say definitively what trends. I know that one of the key emerging issues was that there was vaccine hesitancy in that particular age cohort. The interesting thing about it is that the survey would have been done prior to this public education process taking place. So we do not know to what extent this would have positively impacted attitudes. What I can tell you, though, is, from my understanding, is that there was high willingness amongst our population to be vaccinated. And I think that is simply because we have a history of vaccination in Barbados.
And second question, with regards to the vaccine that we have chosen, AstraZeneca, I'm trying to get the idea, the rationale behind the choice of that vaccine, whether it just be logistical or whether it is that is indeed the best course of action or best choice of a vaccine. And now I premise that by saying that the FDA still hasn't granted that vaccine approval. Even the European Medicinal Association has limitations on the age ranges. Germany also has limitations on the age ranges. What is the rationale for the choice of that vaccine over, let's say, the Pfizer? Is it availability? Is it logistics and storage? Could you shed some light on that for me, please?
If I may, I don't know that Dr. Edwards is qualified to answer why we chose that over the others. I think that may be Ministry of Health leadership, and guide me, is this something that
Yes,
Ministry of Health leadership
but,
and policy? I think too that, and this Dr. Edwards can answer on that, all of the vaccines have an age range. I don't think that you can give any of them to children. So it isn't just this particular vaccine. The
Correct.
vaccines, the COVID-19 vaccine is not recommended to people under 18. I believe I'm correct in saying so?
That is correct. The one that we are.
Right, so there was a
having,
third
yes.
question in your question as well. I don't recall the third question, but those are the first two that I've answered. What was the third part to your question?
Well, no. Well, there wasn't a third part. It was a premise. I was premising the question by the fact that the European Commission has limited, like I know, the persons over 65 not allowed to take that vaccine, and in Germany it will be the age range, I think 18 to 29. I don't know if I have that backwards, but you can I could always double check that. But there are limitations beyond what is allowed in, let's say, the Pfizer vaccine, etc. Canada still hasn't granted it approval. FDA and the World Health Organization is even sketchy as it relates to the approval of that vaccine. So I am just trying to get some clarity as to why that vaccine should be recommended, even if you can't give me from a policy perspective as why it was chosen. Why would you, as a medical professional, recommend that vaccine over, let's say, the others?
This is Father Kirtley. I cannot speak for the government. I can speak about some science in connection with this particular vaccine versus the Moderna and the Pfizer. The Pfizer and the Moderna must be, they're sub-zero temperatures. Like the Pfizer has to be kept at minus 70 degrees. So it's challenging for warmer climates and logistics to administer such a vaccine. Here at the hospital, we administer Pfizer because, of course, we have those facilities to do that. In our clinics, outpatient clinics, we administer Moderna because it can be stored at room temperature. AstraZeneca is a different type of vaccine altogether. The first two mRNA virus vaccines, the Pfizer and the Moderna, they're very unstable, hence they must be kept at low temperature, being the type of nucleic acid they are. And the way how the AstraZeneca vaccine is made is actually, a portion of a DNA, which is much more stable at higher temperatures. Once, you can keep the AstraZeneca for up to 6 months, according to the data that's said. So therefore, I would suspect that warmer climates across the globe might shift toward that one because it's easier to administer and to maintain. Here, for example, Pfizer, Moderna, once you open the vial, you must consume it in a relatively short amount of time. So we have to keep track of what time each vial was open, how many doses, it can't be stored long. So these could be some of the practical reasons why, because I'm not speaking for the government, I'm just speaking strictly to scientists. I know there's hesitancy because the efficacy for the AstraZeneca vaccine is 60-70% versus 90-95% for the other two. It doesn't really matter as long as you have something in your system. So people are constantly discussing the variation between the efficacy rates, and it really doesn't make that much of a difference. You rather have something which will offer protection. And here again, the purpose of the vaccine is just to decrease the chances that if you become infected, you would not be as seriously ill. So therefore, you would not become a burden on the healthcare system or industry. The vaccine does not protect you against ever getting COVID. That's why we have to maintain the physical distances, the hand washing, the masking, all of those things until we have herd immunity and still some. So these could be some of the reasons why a country like Barbados, and I would suspect tropical nations, will tend to go toward AstraZeneca, although it's not been approved in many places. This science is still evolving. This is a very new virus. There's so many people working on this worldwide. This is a global issue, and we're all on the state working hard to try to get a handle on this. So I suspect there are going to be more vaccines that will be coming out as well. So the fact that Barbados is able to get a vaccine, great. If I were there, if I didn't have mine, I would be asking for it too, begging for it. because I see what happens to those who get this COVID, and it is not pretty.
Thank
So
you
I
so
would
much,
really
Reverend
encourage
Doctor.
you. Thank you.
Thank you. Thank you. That was an excellent answer. And I'm glad that it came from you, because, sometimes people think that we're being defensive but both our experts here want to weigh in on this. So I'm going to start with you, senior health sister, and then I'm going to ask Dr. Edwards, please, to also weigh in.
Right. Presently, our capacity here in dealing with the vaccines, we can safely deal with the vaccines within the temperature range that we are currently dealing with. Right now, we deal with vaccines up to minus 30 degrees. The other vaccine, the Pfizer, that is sub-zero temperatures. So therefore, we have to put a lot of infrastructure in place to deal with that vaccine. And ideally, in a climate as like ours, that vaccine might not be the better choice. Also, the AstraZeneca vaccine, that has passed like the others, all 3 clinical trials, and they're being used extensively within the UK, within the USA, and other countries as well. And it's only this afternoon, on my way here, I cited an article within the British Times, which indicates that as a result of recent trials, the effectiveness of this vaccine within the elderly population, the older 65, is, on par within the lower age ranges as well.
Thank you. And we have a significant elderly population in Barbados, so this is really a good choice for us. Yes.
Yes. So to add to the comments already mentioned, so there are many considerations in a country choosing a particular vaccine. There is also a global rush to acquire vaccines, but we have an excellent choice here in the Oxford AstraZeneca vaccine for Barbados, meaning that we have a vaccine that is thermodynamically stable for our climate. So the vaccine is stable up to 30 degrees Celsius, so we can deploy this in the field in our vaccination campaign. The vaccine has standard refrigeration requirements between +2 to +8 degrees Celsius. We are accustomed to this. All right, so our health system, our health sisters, they can handle this perfectly. All right, so when you consider a mass population vaccination rollout, you have to put a lot of things into context, okay? So for an effective campaign, we would want to deliver as many vaccinations as possible. We would like to cover all of Barbados, okay? So we need a tool that is effective, and that's what we are going to get. It is stable in our climate, so we can give this vaccine in our clinic. We can give this vaccine at an off-clinic site. We can do campaigns throughout the island quite comfortably with this vaccine, because it has already been mentioned, we are looking to achieve herd immunity. We want to get the vaccine out there to as much as Barbados, and we want to be able to offer it to all of Barbados, because it matters. If you achieve herd immunity, you can then move to decrease in country transmission of COVID-19. So you're looking at the benefit to the entire population, and this is the key thing to look at here. If we can handle this situation, and we will handle this situation, we get this vaccine out and we deploy it, we will begin to see the benefits of it. So we have chosen a vaccine, and it is an effective vaccine. The vaccine will give you protection up to 70% against symptomatic disease. It will give you protection 62% against severe disease, hospitalization, and death. So we already have an effective choice here, and we also have something that we can use in our environment and get it out to as many Barbadians as possible. So this is a critical aspect in covering the entire population. So the sooner that we can achieve herd immunity, the benefits to the entire population, the visitors and the residents of Barbados will be clear. And that is the goal. All right? You want to get to a point that you decrease transmission, so it's not living in fear constantly of this COVID-19. So we have a tool that will do that. We have a tool that we can use, we can get it out there, we can achieve herd immunity, you get a better result for Barbados. And that is what you want with a vaccine. Remember, it's population, it's individual as well, but we want it out there.
Thank you very much, Dr. Edwards. Ms. Wendy Burke of Starcom Network, you have raised your hand.
Yes, good evening to you. Good evening, Ambassador Thompson. Good evening to the doctors present. My question is for Sister Serrano. You'd mentioned that once individuals on the front line get the jab, they would not be allowed to leave right away, and there's going to be this 15-minute monitoring period. I would like for you to tell me what are some of the possible issues eventualities that could result from that. And secondly, if I'm scheduled as a frontline worker to get the vaccine, what are some of the things I should or should not do on the day that I'm scheduled to have it?
Sister Serrano, before you start, please, just to clarify, this protocol of a 15-minute wait after you've received the vaccine is for everybody, not just healthcare workers. Is that correct?
It's for everybody.
Yes, so take it from there.
Right, and this is the standard operating procedures that we engage in. Anytime a vaccine is given to an individual for the first time, we always advise that person to stay within, the clinic environment, at least for 15 minutes, so that we can see how you react to vaccine. So that is something that is done more or less on a daily basis within the primary healthcare setting. Also, what we expect, more or less mild reactions to the vaccine. I mentioned some degree of pain at the injection site. You might have a bit of fever, but those are things that might not happen immediately. But overall, as I said, with adults, some of them tend to more or less hyper, react to immunizations. So we will just, out of an abundance of caution, we will make sure that you are settled and that you're okay to go before, you leave the clinic. And that facility, we have more or less, as Dr. Ferdinand alluded to yesterday, we refer to it as the recovery room, where we will have trained medical personnel there, so that if you are feeling faint, you might need to lie down for a couple minutes. You might even need a little bit of oxygen. You might even have a mild, reaction to the vaccine, where we will give you, antihistamines there, so that at the end of the day, everything is done with the highest degree of, care and consideration. But we don't expect anything out of the norm. This vaccine has been proven to have, just mild reactions to date. So we are prepared, to deal with any circumstance.
I'm going to ask Dr. Yearwood to come in here. Dr. Yearwood, you are in a hospital system that has administered upward of 11,000 vaccinations. That's a large number. So perhaps you can tell us some of the reactions that you have seen based on actual experience. Have there been severe reactions, not severe reactions? What percentage of people have mild or severe reactions? Perhaps you can speak out of the wealth of your experience in a hospital system that has done a substantial amount of vaccinations to date.
We haven't seen any major reactions at all with any vaccine given, regardless of what you're vaccinating against. You're likely to see mild fevers or malaise or anything like that. In talking to several of our staff who have been vaccinated, some of them complain of a mild fever. Some of the younger people after the second vaccination complain of a little bit of body ache here and there. All within 24 hours, everything was gone and back to normal. You'd expect that with any vaccine. I got sicker with my flu vaccine. I'm required to get a flu vaccination every year since the kind of work that I do. And I dread getting it because I always get a fever or soreness. With the COVID, it was nothing. And most people, although it's a deep intramuscular injection into the deltoid muscle there, most people never feel anything. They sat down there, is it finished already? And there have been no reactions at all. I mean, the standard protocol for any vaccination is to wait 15 minutes. We have people sit around, they chit chat, because you have so many people come in after 15 minutes or so, or less than that, they leave, and that's it. So there's just been no severe reactions at all. And I've interacted with a lot of our staff as I make rounds every day on our COVID floors and non-COVID floors. I've spoken. I'm not in the clinic constantly as people are getting vaccinated, but a couple of times a day I do walk through. And so as a matter of fact, today, we typically are set up to do about 500 vaccinations a day. Just today, we're moving that site because now we're expanding it to have more community members as the governor has opened up to other groups within our CDC system to vaccinate the community. We're moving into another site, and tomorrow I'll be sprinkling holy water on this other big room, and we can do a couple of thousand vaccinations per day. We have 15 stations lined off, so we're going to be moving. And we're all set up to do this, and there are people really asking and begging. The issue is the lack of supplies, the supply and demand situation, but the vaccines are safe. And we've had no reactions at all than the usual, what you would expect. So you would not consider fever or tiredness a reaction. It's what you would expect in any vaccination. You might get tired because that's part of it. So I would say, go home that night, go to bed early, have an excuse to have an early supper, and go to bed. That's just a standard thing with any vaccination. So we haven't seen any major issues whatsoever. And we've also done this out in the field, in our clinics and elsewhere. And we've used both types, both Moderna and Pfizer are approved here. AstraZeneca is not approved in the US, so we have not used it. But we have studied the science and all the vaccinations, including Johnson & Johnson, has just applied to the FDA for approval. So being a scientist and a clinician, I keep up with that pretty well. So I'm using my medical background to say it is safe. I've had it personally, and I've seen lots of people receive both Moderna as well as Pfizer, no problem at all. And as the other vaccines are approved at some point, I'm sure they will, then we'll also be using them as well. The issue is stability for the climate that Barbados is in. And it would be extremely challenging to have Pfizer or Moderna, especially Pfizer, definitely in a tropical place on the globe.
Thank you so
For the
much.
storage.
Thank you, Dr. Yearwood. And I'm saying Dr. Yearwood because you're using your medical skills and not your priestly skills at the moment. Ryan Broom of the Nation newspaper, I beg your pardon, Ryan Broom of CBC, I apologize, sir. He is coming in by Zoom. We're in the final 10 minutes of this evening's press conference, so we're inviting those members of the media that have not yet asked a question, and we do have to share today's dashboard with you, and we do have, I guess, what the press likes to describe as breaking news, and it is not good news. Mr. Broom?
Good evening, Ambassador. Good evening, everybody. My question relates to infection and it's for Dr. Edwards. I'm trying to find out or get some clarification when it comes to something called viral load, and I'm being guided by you here as a medical person. When it comes to viral load, is it that you need a large amount of this virus to get severely ill, or it doesn't matter how much of it you come into contact with?
Okay, so viral load is typically thought of in terms of HIV, but it could be any virus. So the higher the viral load is, that is not necessarily good for that individual patient. In some cases, it does translate into that person being more infectious, yes, but the term is usually associated with HIV in that particular context. But with any viral infection, the viral load refers to the actual amount of circulating virus that the person would have within their system. So the higher that is, that's not a good thing, huh? So the body will take a greater effort to fight it off. But it can be any virus, but yes. So that's how viral load should be interpreted, yes. Mm-hmm.
Could I ask a question here? This is a long haul for everybody. And the frontline workers, the health professionals, they've been going 24/7. I'm just concerned as to how much gas they will have left as we go along the road, and even rolling out of the vaccine. Are there other personnel that can take on and can take over from them for this long haul, or because there's specific people who are doing specific things? Could someone address this in terms of, how they're being stretched and how long, how much more they can go before they're relieved, so to speak? Can you address this?
I can comment about this, not specifically about the situation there, but in anticipation of what you're likely to encounter. Today begins week 51 for us here at Holy Cross in taking care of COVID patients. A lot of time is spent on my end of my office taking care of the well-being of our staff, building resilience and cultivating compassion for them. A lot of effort and time is spent, yes, because all of us are, or to use your term, can gas out, but monitoring that and encouraging staff and giving them opportunities. I've just opened up some oasis rooms, as I call it, to enable people to pause and take 5 or 10 minutes between a long, stressful day. So there are human things that you build into the system, recognizing that no person can go constantly without time to refresh. So I always encourage people to care for themselves. So I'm hoping that there are others who can also vaccinate. And we, in our system, we have the whole team effort. For example, nobody can draw vials by hand. Pharmacists after the ones drawing the syringes, and then someone else gives the vaccine. You can train other people beside nurses to actually vaccinate. You don't have to be a physician or a nurse to give an intramuscular injection. That's a government thing, of course. Barbados may be different, but there doesn't require a tremendous amount of high technical skill to give one of these vaccinations. So you can really broaden who is allowed and who is trained to administer the vaccine. Yes, you have the medical professionals monitoring any signs and symptoms that might occur. So you build into your logistics the ability to care for the staff as they care for the population. It all goes hand in hand to prevent that gassing out, as you mentioned, Mr. Joseph.
Thank you very much, Reverend Dr. Yearwood. Thank you, Mr. Joseph. We are going to, I think, have to take that question on an evening at the start of a program, because I think it is a good question. It does require a serious answer, and it does raise a valid concern. In small island developing states and developing countries where you have a far more limited human resource capacity, how do you shield, protect, and care for your healthcare professionals even as they seek to deliver care to the public? It really is a very relevant consideration. In fact, the competition for nurses, I know, Dr. Yearwood, this is a conversation that you and I had, has now become so keen that nurses are moving all over the country and working for serious sums of money because of the demand for nurses and other healthcare professionals at this time. But I think that in itself is worthy of a more extensive conversation, Mr. Joseph, and I can promise you that we will take it up on an evening when we're not 5 minutes away from news time, and we can give you an extensive discussion, the kind of extensive discussion that I think that it warrants. I want to thank this evening's discussants from the United States, but very much a Barbadian, Reverend Dr. Kirtley Yearwood. Here with me, Senior Health Sister Juliet Serrano and Dr. Omar Edwards, Medical Officer of Health at the Winston Scott Polyclinic. And I believe that Sister Serrano is with the Branford Tate Polyclinic. Thank you, our health professionals here and in the diaspora. And the diaspora is keenly attuned to what is happening here at home, so it is important to bring in our diaspora from time to time. And I think you will agree with me, Reverend Dr. Yearwood was eminently well placed to have the kind of conversation that we had this evening. So we move from thanking our discussants for sharing their knowledge and experience with us to indicating to you that we are going to come back with a third program, but yesterday's program threw up so many more questions. We are going to come back with the third program, which will actually deal with the policy for Barbados and the rollout of the vaccine in Barbados, and that will answer the specific questions on how it will be done, when it will be done, and the details that I'm sure people are now asking. I turn therefore to the dashboard and the commentary on our COVID-19 situation and give you the latest statistics. Please remember that today's dashboard will relate to yesterday, Sunday, February 7th. 23 new cases of COVID-19 were recorded yesterday, and those 23 were out of 1,337 tests conducted by the Best of Santos Public Health Laboratory. We recorded, thankfully, 27 recoveries. That brought the number of active cases on island to 287. The 23 new positive cases comprise 9 women and 14 men. And you will recall that yesterday I drew attention to my concern that every day we are noting larger numbers of men being tested positive than women. 3 of these persons had already been at the Harrison Point isolation facility undergoing assessment. And we explained on a previous occasion that persons come in and are assessed before you can actually count them as a case. So they are there going through an assessment process before they are admitted, or they may not be admitted to Harrison Point. They may be admitted to another healthcare facility, another isolation facility. The PCR tests performed on these persons did show that there were newly positive infections, and Dr. Edwards explained about the viral load. Of the other 20 cases, 18 are Barbadians and 2 are non-nationals. We continue to see a decrease in numbers of cases at the Her Majesty's Prison Dodds, down from 362. I think there are perhaps about 5 persons who are now there with active disease. 4. Thank you. To date, Barbados has recorded 1,732 confirmed cases, 718 female, 1,014 male. 1,427 persons have recovered. The Best Dos Santos lab has conducted 108,286 tests. Up to yesterday, there were 18 deaths from this viral illness. It is now, however, my very sad responsibility to indicate to you that Barbados recorded another death from COVID-19 today. The Ministry of Health, and indeed all of Barbados, joins in expressing deepest condolences to the family of a 53-year-old female who had complications from chronic non-communicable diseases and today succumbed to COVID-19. May her soul rest in peace. We learned today, and it is significant, I think, that on the very day when Dr. Edwards warned us that young people, not just the elderly, not just people in their 80s and 90s, as our death profile has shown to date, but that younger people are very much succumbing to this disease all over the world. They're also in isolation. They're also in ventilators, people in their 20s, people who appeared perfectly and were perfectly healthy prior to contracting COVID. All of us must therefore be careful. Wear our masks correctly, wash our hands often with soap and water, or sanitize properly, as Dr. Edwards demonstrated, with a sanitizer that has at least 60% alcohol. Stay at least 6 feet away from people whom we do not know. And within our own homes, let us exercise care and caution with our elderly family members, with those we know who have chronic non-communicable diseases, and indeed just with each other. This is an invisible enemy, and we must win the battle to beat back COVID in Barbados. Each of us is a soldier in the army for that battle. And we do not want to see any more people fall if we can help it, nor do we want any more infections. We have to stop the infection cycle, and it is up to all of us to do that as the government does its part. Good evening. God bless, and God bless Barbados.